I'm going to start by introducing myself because I am definitely the least important person on your screen at the moment, and I'm proud of that fact. My name is Gil Rogers. I head up marketing here at Immersify. I'm excited to be a part of this conversation today and a part of this presentation. Today's conversation is Innovating Dental Education in 2025, Interdisciplinary Insights and Digital Strategies. In a few moments, we're going to have our panelists introduce themselves and really have what we hope is a very insightful and thoughtful conversation to drive some of your decision making and your thinking when it comes to supporting students and supporting the advancement of dental education in 2025. Before we get started, just a handful of housekeeping items. So you are aware, this webinar is being recorded, and we will be sharing it with you before the end of the week so that you can then share it with all your friends and colleagues and provide them with the insightful commentary that you took on and took part in today. Don't be shy. We encourage you to ask questions in using either the group chat or in the Q&A feature. We'll be either pausing to answer, and it looks like chat is disabled. We'll work on getting that turned on for everybody here in a minute. I'll do that. I'll try to figure that out during the opening. If not, feel free to throw it in the Q&A feature, and we'll have those conversations. We did test that. We'll get it fixed. But in the meantime, throwing where you are in the Q&A, so we know where everyone's from. We already have somebody from California, so that's another time zone. Well, we already have the West Coast covered, but now we have another state covered. What I will do now is turn it over to Chloe Barrett, who's the founder and CEO of Immersify Education. She's going to be moderating the conversation today and introducing our panelists. So, Chloe, I will turn it over to you.
Thank you so much, Gil. Hi, everyone. Really great to be here. Really thank you for joining this webinar. I think it's such an important area, of course, in dental education in terms of the technology and the advancements that we're seeing in technology in dental education. So really excited for this webinar and this conversation that we're going to be having with our amazing panelists. So yeah, thank you so much for joining. So I just wanted to give a really, I suppose, a quick overview before the panelists go into more of an in-depth conversation into lots of different topics. It's more around the landscape of dental education and what we're really seeing. So we collated lots of different areas from our partners and really to look at really what trends, I suppose, what advancements are happening and what really should we focus on in dental education and what advancements are happening. So thinking about firstly digital and AI. AI, of course, is a big topic right now. And of course, being safe with AI is very important, but the things that can be really used for good in AI. So the things like clinical diagnosis. So if we think about, identifying different things with radiographs and also using it for personalized education. So thinking about AI patients, AI personalized content that, really encourages learners to learn the way they wish to learn. Number two, we're really looking at augmented reality and virtual reality. So although these are slightly different technologies, they both provide a very simulated experience. So thinking of bridging that gap between theory and practical learning. With augmented reality, you're able to do it on your phone, on your iPad, wherever you are, whenever you want to access it. So just having that accessibility of the technology, which is very engaging, is very key. And so we're seeing a huge adoption in augmented and virtual reality technologies. The other thing with simulations is that we are seeing that students can fail safely. So within these environments, they're able to practice as many times as they want to enable them to really learn efficiently and to be able to learn these skills and these clinical skills before they go into a clinical environment. So very important for small and large assessments to see these technologies enabling our students to fail safely. And so going into clinic and going into practical environments, they can feel more confident in those environments. So that's been a huge, huge area of growth in dental education and continuing to be so. The other one we're looking at, and everyone really within our network is looking at, and I know there's a lot of research in this area, is personalization and adaptive learning. So really embracing personalized learning for every student. So allowing the students to learn how they wish to learn, whether that be by more visual content, by more audio, by more written, they can really choose and personalize it. So thinking of that more personalized learning journey is really key for that really impactful curriculum delivery. And gamification, again, lots of research has been done in this area, and it's shown extremely valuable results, hugely positive results through gamification. And really thinking of how our students learn. They learn very differently than we used to learn. So we really have to adapt to that. So embedding elements of gamification to make learning fun, but also to keep engagement is very key. So making sure we can see how gamification can be merged into these critical topics and critical areas in dental education. And then lastly, I'll mention data. Again, a huge area that's discussed throughout dental education. Data is key for us as educators to know how well our students are doing, how well we are doing as educators. Are we focused on the right areas? Do we need to focus on other areas more than others? So us as educators being able to have instant information at the end of our fingertips, we've never seen this before in really history. So the advancements that are happening now in the dental education space with how we can use data is key to our future in dental education. So it's very critical for us to really understand through small and big assessments how well our students are progressing. And then also, I think all of this is wrapped into that evidence base. So through data, we can show evidence, we can show how things have been performed individually and also as a cohort. So very much focused then on how do we bring that all together and how do we evidence that as well? Because of course, it's very, very important and critical to dental education. We evidence what we do. So that's equally very, very important. So I will leave that there. I know there's a few more areas that are covered within the technology space, but these four are the main drivers in the market currently and ones that are being heavily adopted by dental schools. So yeah, I thank you very much. And I will pass the mic over to the very impressive Dr. Carolyn Brown.
Thank you, Chloe. I hope everyone's doing well. I've enjoyed seeing where everyone is from in the chat. I'm a dentist by training. I also have a master's in education. My master's of education is actually in distance-based learning focused on the postdoc dental resident. So I bring my experience both at UCSF and at University of the Pacific and starting and spearheading AGD residency programs at my former clinic to my thoughts here today on this webinar. But I think also important to note is that I am a software founder and have had two dental softwares and medical software platforms. So I understand the agility that software can offer. And I wanted to be able to not only speak to my points on this slide, but pick up on a couple of things that Chloe had said. So I made a couple of notes. I think really meeting today's students where they live, work, play, and go to school is really important because unlike when I was in dental school, students are going out into communities and providing services at all kinds of different locations as pre-docs, and oftentimes again during residency and after. So the ability to be able to use our phone for everything and to have a calibrated source of truth that can not only just give them something in writing like Wikipedia might, but be able to help them learn and visualize and connect the dots from the way that they're used to learning. So when we talk about learners having all types of learning styles, there are typically three things we look at: auditory, visual, and kinetic. And in reality, anyone we're teaching to do anything related to oral health and dental, be it dentist, resident, nurse, hygienist, any staff member, we have to always be able to help them very quickly go from learning and absorbing information, being the novice in the room, to being able to visualize working in the actual space in the mouth, and oftentimes in very small surgical fields. So I think, this type of a platform and these types of dental software really, I hope, are embraced more and more as we see the evolution of education and dental and education in particular. One of the things that I think is really important, and I think that, Chloe talked about this, like sort of in the data part, and, her comment around, it can build personalized learning journeys for learners, is that as an educator, as someone responsible for the curriculum or the progress of a cohort of learners, or as a residency director, you want to be able to dashboard and see what parts of the platform your particular cohorts are using, what they go back and look at a second or a third time, what else they may be accessing that might or may not give you some clues as to how you could continue to lay down bricks faster to accelerate not only their mental knowledge, but that translation to the clinical side. So I really love that dashboarding piece, that a platform that is really as cohesive and multifunctional as Immersify offers. And I think that, one of the last parts that I'd like to touch on is that, as dental educators, we always have had that mentorship and peer-to-peer learning piece very much built into the way that we have planned dental education and dental education postgraduate. I think this is also a time where we can start to trust the software to help us calibrate all of those learners. As an AHD residency director, I would, get dental students from all over the country, from all different types of dental schools. And we were all hands on deck the first 2 months that they were on board in our clinic, because we realized that not only did the dental schools have different areas of expertise or training, but that the students themselves gravitated towards certain things and not always towards other clinical skills that were necessary. So I think really embracing the technology, which is what software is great. It's a great use of resources. And I think as we're seeing workforce shortages in clinics and offices, DSOs and dental schools for everything from front desk to dental assistants, if you've ever tried to launch an on-the-job training program, for a dental assistant, it's just even translating the dental language can be very difficult. So I would say this is where I see Immersify not only having a lot of play in the workforce piece, but also we really need to address the elephant in the room, which is oftentimes the faculty shortage and the long periods of time it takes schools to find appropriate faculty to fill key staff. Thank you. And now I'm going to turn it over to the amazing Dr. Susie Bergman, who is not only the incoming president-elect of the American Association of Women in Dentistry, but is also a highly respected professor and dentist, really focusing on interdisciplinary education.
Thank you for that introduction, Carolyn, and thank you all for being here. This is very exciting for me to be given an opportunity to speak with such a wonderful group of participants and on this distinguished panel. I will just say a couple other things about myself. I am an educator and a clinician with a focus on temporomandibular disorders and orthodontics, but really TMDs are my main focus of not only education, but research, advocacy, and infrastructure. And I'm really thrilled to be part of the Immersify team now as a director of dental education for the US sector. And I get so excited when I talk about Immersify because this is really bringing content to life. So, you know, those of us who went to dental school in a different century, I'm aging myself, but we lugged around these big textbooks. And I always say, you know, if you needed money when you were a dental student, the first thing to go would be a textbook. So that's just being honest in front of all the educators here. But the amazing thing about Immersify, as Carolyn mentioned, is that we always have our phones with us for any type of learning tool and platform where we have it at our fingertips. We're able to really practice the things that we need to learn to just master. So I read a really interesting narrative review in the Journal of Dental Sciences that came out in December. It summarized the PubMed search and Cochrane review, highlighting research that shows that AR and VR improve dental procedures and precision for students, which leads to better outcomes in activities such as anesthetic delivery or implant placement. It's also very helpful in assessments such as the OSCEs, showing that interactive simulation plays a significant role in dental surgical education. The thing that I love about these types of learning platforms is that you can repetitively practice something in a safe, controlled environment, which has a positive effect on the student's psychological well-being because it reduces their anxiety. And it also is better for patients in terms of safety because we're reducing their exposure to potential risks by novice training sessions. You know, you don't want to be the first person that someone does a procedure on. So it's always wonderful when they have opportunities to practice. In terms of gamification, a cross-sectional study that I recently saw found that games held and motivated students' attention, and it helps them understand and retain lecture concepts, as well as aiding them in preparing for exams. So next slide, please, Gil. I was asked as a course director what would be on my wish list. What did I wish that I had when I first started teaching or preparing courses? And this slide just shows us that you can have something to help you before, during, and after a lesson. So we can have pre-matriculation programs that are offered to students prior to entering dental school to help them develop skills and knowledge, critical thinking skills, an understanding of how different disciplines relate to each other, and develop a capacity to adopt or adapt to new practice models. During the curricular integration, we can just take these concepts from other disciplines and show the students how to integrate what they need to know about different disciplines in terms of what is relevant for oral health and how oral and systemic health are linked to each other. And then remediation content, I read a really interesting survey that was done on a remediation activity, and it showed that current efforts toward remediation are inadequate. So for this particular activity, it was a waxing exam, and after the students completed the remediation, one dropped out of school, 3 of them, or maybe I think 4 of them, had a need for additional remediation. And so that tells us that we need to have things that students can do without putting added pressure on the faculty. So if they have a digital learning tool, they can have more opportunities to study and get immediate feedback, to focus on the areas where they're struggling, and then that will boost their confidence. So with that, I would like to turn it over to my amazing cohort from the UK, who is the education guru. In fact, he's the one that is bringing a lot of content to life for us, and that's Dr. Martin Ling.
Yeah, thanks ever so much, Susie. That's really kind. It's great to work with you too. And no, thanks for everyone's time. Super excited to be here, and great to be here with the panelists. So yeah, very excited. So as Susie very kindly introduced me, I'm Martin, and I'm the dental education lead here at Immersify. So I joined Immersify a little over a year ago. And then prior to that, I was a clinical lecturer in perio at the University of Birmingham for just under 10 years, and then moved over to industry in a number of roles in clinical research and clinical education. And so I was posed this sort of question to sort of start with. So as I'm a professional now in the field of ed tech, what do I feel is important? And I think just to sort of trigger off this webinar this evening and this afternoon, the points I'd kind of like to make is I think it's important for us all not to forget our overall aim with dental education, and that's to improve the dental health of our patients, and also to always keep our patients in mind. But at the same time, also to embrace evolving and expanding digital technologies. It's amazing what digital tech that we now quite literally have at our fingertips. I was kind of thinking about this webinar this evening before we kicked off, and I was thinking, even when I was like a dental student, I don't even think webinars were a thing back then. And so it's amazing just all the opportunities that we have as educators. It's a very exciting time. But at the same time, dental education has its challenges. There's a lot of different things to consider for dental education. For example, we not only have to educate the students, but we also have the patient aspects to consider as well, and always to remember that patients' health has to be a priority. So we have to juggle that. Plus meeting relevant standards and meeting requirements by professional organizations, CODA, ADIR, etc. And also educators also have other commitments with research, etc. So there's lots of different things going on in the dental education space. It's quite a complex area. But as Chloe mentioned as part of the introduction, I think one of the really exciting areas for me on a personal level is helping to bridge that gap between theory and practice. I think everyone on the call here who is a clinician will almost certainly remember making that jump between theory and practice. So for example, giving your first local anesthetic on a patient, or your first charting, and how nerve-wracking that can be. And embracing these digital technologies can help with student performance, but also in their confidence as well. So lots of different things to consider. So really looking forward to the discussion this evening and this afternoon. And with that, I believe I'm passing over to Dr. Foti.
Thanks, Martin. Appreciate it. So I'm Foti Panagakos. I'm the founding dean at Pacific Northwest University School of Dental Medicine. Excited to be here as well and to share the virtual platform with my friends and colleagues, as well as the team at Immersify. I'm going to talk a little bit about what we're doing here at PNW. I have the privilege of leading a fabulous team of faculty and staff who are preparing for our first class of DMD students, which will arrive on July 28th of this year. So the mission and vision and values of our school are listed on this first slide, our focus is really to recruit individuals from rural and underserved areas within the Pacific Northwest, the state of Washington, where we're based, but beyond that, even throughout the United States, and really bring them into a humanistic environment here at the school, and then train them in such a way that they are providing care to rural and medically underserved communities within our region. And then the hopes is that they will go out and provide care to those communities when they graduate. Our vision is really to revolutionize the way we provide community-based oral health. It's in an integrated fashion, as I'll talk about in a moment. And then you can see the values that we hold as our core as we go about identifying students to join us, identifying faculty and staff, and staying obviously true to our mission. So our program, which we can go to the next slide, our program is a 4-year Doctor of Dental Medicine program. We're a small program. I believe we're the second smallest program once we enroll our first class in July of 36 students. We can increase our student enrollment up to 60. We have capacity on campus, the way we've designed our training facilities to allow that expansion. The model is very different than pretty much, I would say, every dental school in the US. Our 36 students will come on to the main campus. We're located in Yakima, Washington, which is South Central Washington, about 2.5 hours south and east from Seattle, for those of you who are kind of wondering where we're located. They will come to the main campus and do their first year of dental school here with us in Yakima. Part of that curriculum is an integrated curriculum in biomedical sciences with the medical students here on campus, and the balance of that curriculum are what you would typically see in a first year curriculum. We've somewhat front-loaded the first year curriculum because our plan is to have the students begin to provide patient care in year 2, at least for a portion of the week. But at the end of their first year, the students are then divided into 3 groups of 12, and they report to one of 3 community-based clinics that we've established with 3 federally qualified health center partners here in the state of Washington. So 12 will remain here in Yakima, and they will be at a Yakima clinic. 12 will go west to Tacoma, where a clinic is being established for them. Tacoma is about 45 minutes south of Seattle. And then the final 12 will head east about 1 hour and 20 minutes from Yakima to participate in that 3rd clinic. These clinics are integrated clinics. They have primary care, behavioral health, pharmacy, child and maternal health, substance abuse services. These are integrated clinics. The students will have their own clinic that they're working in, so they're not in with the FQHC doctors. They have a separate clinic that they work in. They're supervised by PNWU faculty in that clinic, but the patients are patients of the FQHC partner. At each of the sites, we'll be using an integrated health record. At 2 sites, we'll be using Epic. At the 3rd site, we'll be using NextGen, which is similar to Epic. And the whole idea is to really elevate the interprofessional education opportunities and integration of care by having the students co-located with these community clinics. The students will stay at their clinic for 3 years. They will not leave and rotate to other clinics. However, we have included an extramural rotation option in the 4th year for our D4 students, where they can go out and do 6 to 8 week rotations at other sites within the Northwest, possibly, if they're from another state and they'd like to go back there for a period of time, just to experience a different practice setting as well as a different patient population. So in starting a new program, you have sort of the bright yellow lines that I like to call the CODA accreditation requirements, but there is a lot of white space between those bright yellow lines. And I think for me, one of the reasons why I came here to this program and took on this this challenge was the ability to do some innovative things within the curriculum. Starting a new program, you're not as restricted as existing programs are, and we could spend an entire webinar just talking about some of those challenges and trying to incorporate change. However, with a brand new program, you have some more flexibility, and one of those areas that we really wanted to take advantage of was harnessing all the technology opportunities that exist within dentistry and dental education today. So whether that's incorporating CANCEF CBCTs in all of our community clinics and training the students how to utilize that technology in the diagnosis and assessment of their patients, 3D printing and CAD CAM, producing prosthetics, using digital workflows. We've incorporated the Sim2Care virtual reality system in our program. We'll have units here on the main campus as well as the community clinics to allow that practice that Chloe mentioned during her intro throughout the entire program. We're going to be using teledentistry for integration between the 3 clinical sites, as well as for work with specialists and other folks that we need to bring into the patient care arena. And we've partnered with Immersify as an educational platform to deliver the content that they're providing. And our faculty currently are working on how to integrate that aspect of the curriculum into what they're doing. So it's a real exciting time to be in Yakima, and we are really looking forward to welcoming our first class and really launching this innovative program. So I want to thank you for the few minutes to talk about our program, and I'll turn it back over to Chloe.
So much, Foti. So we've collated a number of really interesting questions from our networks. And with that, we have really highlighted 4 key burning questions that dental educators we know, our partners, our network really want to know more about. So I'll start with the first question. I will hand this actually off to Foti for the first question to start with, and then please everyone else put your thoughts in as well. So the future of dental education, a big question, not one we can answer just in this webinar, but we'll give it a go all together. So as we move into 2025, really looking at the future of dental education, what do you all see as experts in the space, educators, clinicians? You've experienced a lot in dental education. Where do you really see the digital impact and innovations in dental education? So really these tools that we have to hand now we've already highlighted quite a few of them already in these topics that we've all spoke about. But where do we really see these tools reshaping clinical training? And also, how do we use this in student engagement? So I'll pass that first question on to Foti first. And then, as I say, everyone, please, as conversational as possible.
Thanks, Chloe. And I think we've covered a lot of what I'm going to respond to in this question. So I will try to keep it brief, and then hopefully my colleagues on the panel will enhance what I've shared with the group. The first thing is I believe this interactive learning platform that we've mentioned a few times. It's really a nice bridge between engagement and enhancing engagement and the active learning that we really want to see with our students, and bridging that gap between what would be theoretical knowledge and classroom knowledge to hands-on skills. I think it makes for a more enjoyable environment for the student to learn in, and it makes it more memorable. It also allows for that personalized learning that we talked about earlier, as well, which are really, really important for skill development. The second area is the virtual and augmented reality that I've mentioned a number of times. We have the Sim2Care unit here. It really provides an immersive learning environment that allows you to simulate real-world clinical scenarios. It allows students to practice procedures, again, in that risk-free setting, so they can, practice and identify when they make a mistake, and in the SimToCare units, they can actually go back a certain amount of time and then continue the procedure. It's all recorded, so our faculty can track what's going on and see what they're doing, which is great. And it definitely leads to enhanced comprehension, enhanced understanding and retention. The AI and machine learning is going to be a big area as we go forward. AI relative to a lot of the diagnostic tools that we are currently using and will be using in the future, but also the ability to analyze student performance, tailoring educational content, creating simulated patient cases for practice. All of these things are going to be really important, and our plan is to try to move away from sort of the traditional classroom where you have someone, lecturing to the students, where it is more interactive, case-based learning. And so we'll see. This again is our new program, and we have a lot of high hopes, but sometimes things don't work the way you expect them, and you have to course correct during the process. I think a real exciting part of our curriculum is the digital workflow, and using digital tools like intraoral scanners and the CAD/CAM systems and 3D printing. I think I feel we are in sort of a transition period where we are still going to be training students using the more traditional, what we would call analog methods, but at the same time, we have to train them on the digital. Our plan is in our clinical sites to be digital first and foremost, but we do have to be able to fall back on the analog depending on the situation. I mentioned the teledentistry and these remote learning platforms. We're going to have 3 community sites, and we're going to have to integrate those sites using remote learning so that the students get the education from a quality standpoint that you would expect if they were in the room together. And then that ability to use teledentistry to connect our clinics and our students and the professionals that are supporting them is going to be very, very important. So, to me, it comes down to, 3 areas that I think these 5 sort of mega influences will have on our educational process. One is enhancing practical skills. This is, through simulation and hands-on training. Improving efficiency. The digital workflows definitely streamline clinical processes. Sometimes they're more accurate than the traditional analog, and it will allow students to be more productive and hopefully get to see more patients than what you would routinely see in a dental school clinic. And then finally, just fostering engagement, getting the students engaged with each other through these different platforms and technologies, which is going to make a much more enjoyable and hopefully effective learning environment for the students. So those are the things that I just wanted to touch on briefly, Chloe. I would love to hear from the other panelists if they had anything they'd like to add or maybe even challenge what I listed. Maybe they have a different opinion.
Thanks so much, Vote. We'll probably keep it really short. I don't know if anyone has any quick remarks. I know we're against time now. We need to move on to the next question, but please, anyone, if you have anything, you can fire at Vote's thoughts.
There's a lot there and it's all good.
You all agree? Great. Okay, I'll move on to the next question. So thinking about interdisciplinary learning in healthcare, so how can we collaborate? Really looking at that growing trend in healthcare education. How can dental programs really merge these disciplines together? Thinking of nursing, medicine, PA programs, how can we really work together? And how can we improve that student learning and, of course, the patient care? So I will pass that question over to Susie.
Oh, I love this question. Thank you for letting me answer it. So I am very passionate about bringing teams together, different disciplines in the same learning environment, because we have so much to learn from each other. And we also need to learn how to collaborate and communicate with one another. So if we don't learn this in dental school, it's going to make it much more challenging once you leave leave that education environment. And this is one of the things that I love about the dental school that FODI is envisioning. And I am really, really happy to see that we'll have an opportunity for students to learn alongside physical therapists, nurses, speech pathologists. There are so many different disciplines who should be brought in. Nutritionists, you know, we chew with our teeth, and that is the first part of digestion. So how can we think that this isn't related to our gastrointestinal health, for example, our digestive health? I have a quote that I always like to share when I'm on this topic. It kind of guides me in the way that I practice and do research and education. And it says, natural law did not divide us into three parts: medical, dental, and psychological. If society chose these divisions for the purpose of healthcare delivery, then each professional group bears a special responsibility to be sufficiently informed about the others so that total integrated care can become a reality. And I think that we have such a great opportunity in this digital age to bring all of the disciplines together for holistic, whole person health. We can do this through joint case studies. We can do it with guest lectures, through clinical rotations in medical schools versus dental schools, simulations, things like patient education materials. They can be tailored for the patient so that they understand how their oral and their systemic health are related to one another and intertwined. And I always like to add that it's not just the medical and dental integration, but also the behavioral health piece of things that really enable us to have better outcomes for our patients. So I'll just leave it there and see if anyone on the panel wants to add something.
I think you said it all, Susie.
Yeah,
Amazingly,
I think you said
amazingly
it
put.
all. And I would just say too, this is where, I mean, I go back to, you know, community partnership and grant seeking days, both when I was in public health and the Indian Health Service, and then when I was on the education side. And as you know, we know NIH, for instance, is looking at ways where they can cross collaborate across their different, you know, centers of excellence and funded centers. I think this, you know, provides an opportunity that's much more modern and technologically savvy as we are looking for ways to not only, you know, use something like Immersify across multiple kind of health sectors, but to really think about how can we use it day in, day out. And when you have, you know, pilot RO3s or RO1s or things around reaching certain communities, I think this is really a place that is much more, you know, modern and accessible to all when we really think about even, you know, language capabilities and those types of things.
And just
Amazing.
to very briefly add as well about, I think it's going to be increasingly important with the links between oral and systemic health. I think it's going to be a growing area for sure. And I love that quote as well, Susie. I may need to borrow it.
That was amazing. Thank you all. Really great input. Third question, if you may, Gil. Thank you so much. So thinking about adoption and the implementation of all of these digital tools that we have to hand now, of course, in different areas, for different reasons, for different case studies. But thinking about, of course, putting ourselves in our own shoes of educators and how faculties often do face challenges adopting new technology. It is a hard, you know, landscape to navigate. But actually thinking about what practical strategies can we use to successfully integrate these tools into the dental curricula. So also while ensuring that faculty feel, you know, they're embracing the technologies and feeling confident with using them. So I would like to pose that question to Carolyn, please.
Yes, I mean, as you all have probably heard, I always kind of go to the implementation phase first and then try to reverse engineer. I think, the Immersify team is, or any other software that you might work with, is really the place you should ask some of those questions. As I saw someone in the chat is, used to teach anatomy, right? So instead of everyone knows the Netter book and has bought the Netter book for the last 80 years or so, but if you have questions about the sources, this is really where Immersify and the US and UK teams can really help to answer those questions. But I would almost, say this is where pre-matriculation, for instance, is an ideal time. It's the rose-colored glasses that people who have gone through the arduous process of getting into dental school or getting into a hygiene program, they know what school they're going to, they paid their deposit. Now they have 2 or 3 or 4 months or 6 months before they start. Why not allow them access to pre-matriculation access to Immersify so that they can start to really learn and see what's in front of them? That would be one place that I would start to think about. I also think as so many schools have opportunities and have interdisciplinary education or case studies built into their curriculum as early as year 1, this is the place to also be able to have fun with your medical, veterinary, osteopathic medicine groups that are sometimes in those interdisciplinary cohorts, so that you make it an easy resource for everyone to use on a case. And as they start to do that, they will discover and get used to different parts of the program. I think that on the student level are just, some of the ideas. I can also see it being used very effectively if there's need for remediation, or you have a cohort of students that have started and are seemingly not on track in the same type of track that you would like to see them on. And on the faculty side, again, change is always hard. Technology is always hard. I think there's enough fun, interesting neuron firing parts of Immersify that this is the perfect opportunity if you're looking to bring it into your dental school and faculty. Obviously, there's a vetting process, but there's also the way to really go to the experts at Immersify or another platform so that they can help you identify some like aha moments and light bulbs that have gone off for other programs who currently use the product.
Yeah, so we're doing exactly what you suggested, Carolyn, and trying to use that time between now and July 28th to give the students a little bit of a leg up. Part of it is going to be working with Immersify and getting that pre-matriculation sort of package so that they can download the app and give them a limited number of initial lessons that make sense for them to try to get their feet wet. So we don't have a real steep learning curve when they show up as far as using the technology. The other thing we're doing is we have a number of students that are, I would consider, non-traditional. They're not coming straight out of college. They've left school and now they're coming back, or they were in the hygiene community and now they're coming to dental school. This was something they've always wanted to do, and we're giving them that opportunity. But they've been out of school for a while, and biomedical sciences have enhanced and changed. And so, working with our medical school faculty, we put together a sort of a mini biomedical science prep course that can be done over a 4-week period, totally online, self-paced, but the faculty are available to provide support. And so we're going to offer that to our students. Certain groups of students will be asking them to do it as part of their acceptance, but all of our students will be allowed to participate. In the medical school, once we started putting this together, said, well, why don't we offer this to our students as well?
Oh, I
Because
love
it's
it.
really a precursor to the biomedical science course that they're going to be taking in the first year. So again, it's an experiment. We'll see whether it helps prepare them, but we think it'll be a great opportunity to use that time, as you mentioned.
Well, I love that. I mean, I've been working on expanding the pipeline of types of, populations, socio-demographic diversity into the dental sciences, I feel like my whole career. So it really is the opportunity to do that. I was a non-traditional student. I had worked in the workplace having nothing to do with biomedical science before I went to dental school. And, I think it would have been nothing but helpful. I did come up with one other thought, which is, it's also an opportunity as you have residents or even dental students who need to do some sort of a capstone project, to really look at this from like the learning piece. I know when I did my master's in education program, there's lots of dental education literature and studies that are out there, but not a lot of it has been done, on like the use of distance-based learning and digital platforms. So I think there's lots of opportunities to work with grants and to work with, emerging research for the next generation of students.
Amazing. Thank you. Very well said. Really insightful. Thank you. Final question. So thinking about content and digitalizing education, so scaling content, thinking about how our standards of content for digital education and how can institutions really ensure that they are effectively scaling and standardizing, and also having high quality instructions and clinical training within their content and education resources. So I will pass this question on to Martin. Thank you.
Yeah, thanks ever so much, Chloe. I think it's a great question, and I think it's a question that's going to be relevant for everyone on the panel and pretty much everyone on the call, I'd imagine. And so with these digital education opportunities, I think they bring with them a lot of excitement, but also some degree of apprehension as well, which I think is natural. So I do think it's a great question. But we have a lot of opportunities at our fingertips. We've touched on a number of them with the other panelists today. But in terms of scaling and standardizing, when I was thinking about this question earlier, I think it's about balancing the innovation with quality assurance. And in the limited time I have now to sort of answer the question, there was a few thoughts I thought I'd share with the panel and with everyone on the call. So as you quite rightly pointed out, I'm not aware of any uniform standards that cover all aspects of digital education. But what we can ensure is that the content that we do have within digital education aligns with the standards that we do have, like, for example, relevant accreditation standards, frameworks from professional organizations and institutions. So the ones that come to mind, particularly for the US, would be, of course, things like CODA, ADA and ADEA, for example. And then with these materials is then integrate them within the curricula. And I think that the key word there being sort of integrate and to really embed them into the programs rather than treating them solely as add-ons. And I think that's important because education clearly doesn't happen in a silo. We recognize that students learn differently. We all do. And I love the ideas that's being discussed here about the pre-matriculation, for example, recognizing that students approach dental school from a number of different backgrounds. I think they're really great discussion points there. And I think we've already touched on as well an element of the faculty and student training and onboarding, supporting individuals through this journey. There's a lot of change happening, a lot of opportunities for us, and to sort of standardize the approach that way. And also that's going to be a long-term process as well, because things are changing all the time with new technology. So keeping everyone updated about emerging tech. And then very briefly, just to allow some time for further Q&A, just about the QA processes as well with digital education, just ensuring that we have relevant and robust quality assurance processes in place and all the content is peer reviewed. I think, as you mentioned, I think in one of the earlier slides there, Chloe, about the use of analytics and feedback. There's a whole data there for us to mine and then to contribute to the evidence base. As I mentioned, we're all learning from each other. And then finally, with this one challenge, it's just to really keep it in perspective and not to forget that digital technologies are going to be increasingly important, I do believe. But they are just one piece of the educational puzzle that we have to juggle. It's never going to be a replacement for real life clinical training. And so I think it's just important to try and get that balance right. And happy to get anyone else's sort of thoughts as well. Lots to cover.
Thank you so much, Martin. That was really, really insightful, and I think a great way to end. We are running out of time now. I know we could probably carry on for many more hours talking about dental education and technology, as we're all very enthusiastic about the future of education and future of dentistry, of where we're going now is the most exciting time I think we're ever going to experience. And I think, you know, jumping on board of this wave and all collaborating is key to success for all of our success and for our future students, professionals and patients. Really, we just want to collaborate and make the world a better place in dentistry and in education. So thank you so much for joining the webinar today. And thank you so much to our panelists. You were amazing, and the insights you bring are phenomenal. I'm learning from you all the time. It's amazing. So just want to let everyone know, we do have a link as the webinar concludes that you can reach out to us. I'd love to speak to anyone that would be interested to learn more about what we do at Mercify if you want to have any further information and just about technologies in dental education as well. So thank you so much for joining us. And yeah, reach out if you have any questions. So thank you so much. Looking forward to the next one.
Thanks, everybody.
Thank you.
Chloe.
Thank you so
Nice to
much.
see you all.